Thank you so much for joining us today on our Alzheimer's live chat for the month of February. My name is Lakelyn Hogan, and I am the caregiver advocate at Homestead Senior Care. I want to thank you so much again for joining us today, taking time out of your busy lives to tune in to today's topic. Our live chats are brought to you by Homestead Senior Care, a network of locally owned franchise offices and your trusted home care agency, helping you keep your aging loved ones in their homes as they grow older. And before we start today's chat, I wanted to go over just a few housekeeping items. To start out, I wanted to let you know that we have muted all of your lines to reduce the background noise. We want you to be able to enjoy this webinar and still, maybe do some things around the house or talk to people. So feel free to do that while you're listening. We won't hear you on our end. And then I wanted to let you know that you can type in your questions. We always love having questions come in. So please feel free to chat them in now or, as we go along, if a question pops up, don't hesitate to type it in. We are more than happy to answer your questions. That's why we're here today. And then don't worry about taking notes. We are going to send out a link to the recording of today's webinar along with any of the resources that we mentioned. So again, don't need to take notes. You'll get a follow-up email with the recording. So with today's webinar is about relationships and dementia. With the recent Valentine's Day holiday, we thought it might be kind of a nice topic to bring up. There's a lot of changes that occur when someone's diagnosed with Alzheimer's or another type of dementia. And as the disease progresses, these relationships that we have in our lives and these family dynamics are significantly impacted. And one of these reasons is that the person with dementia might be experiencing some personality changes. I mean, I'm sure we've all known a lady with dementia who was sweet as pie, never said a curse word in her life, and because of the dementia has had a personality change and might be swearing or doing things that are completely out of her nature. And then there's also a role change from a spouse to a caregiver or from a daughter to a caregiver, and that transition can be very difficult. It can result in a range of emotions and even cause some conflicts, especially when it comes to different care responsibilities within the family. So here with us today to talk about all of these complex relationship issues is Karen Garner. We are so excited to have her as our expert for today's live chat. Karen is an advocate in the fight against Alzheimer's disease and is passionate about providing support to the families affected by the disease. Karen has personal experience as a family caregiver for her husband, Jim. Jim recently passed away from younger onset Alzheimer's disease. Karen bravely shares their family's experience through her advocacy work. She meets with lawmakers, she is a blogger, and participates in a variety of Alzheimer's-related events across the country. Karen is a mother of 2 children who are active in sports and school activities. She's also the founder of the Garner Foundation, which you can learn more about at thegarnerfoundation.com. You can also read more about her experiences at missingjim.com and on our website, helpforalzheimersfamilies.com. So, Karen, thank you so much for being with us today. Welcome.
Thank you, Lakelyn. What a wonderful introduction. I am so honored and so glad because I'm really excited about this topic today. And I really think that this is an important subject that just isn't covered enough. So thank you so much for allowing me to be part of this conversation today.
Oh, most certainly. It's our honor. And as we were kind of chatting a little bit before we got the live chat up and running, we were talking about how this is kind of a sensitive topic. It's not really discussed. It's kind of almost taboo, some aspects of discussions around relationships and dementia. And I just kind of want to put a disclaimer out there. We might be talking about some more sensitive and personal subjects as it relates to dementia. So Karen and I don't intend to offend anyone as we kind of go through some of the different questions that people have written in, but want to know that we're here to give some advice from our experiences or tips on what we've heard and learned along the way. So I just kind of wanted to throw that out there before we got started. Um, but when it comes to relationships and dementia, I mentioned earlier, there's a transition from that, um, familiar relationship role into more of a caregiver role. So Karen, if you're okay, I'm going to jump in with a question right off the bat.
Yes.
Are you good to go?
Go right ahead.
Okay.
I'm ready.
All right. So we had a get right in, and she said, I'm a caregiver for my husband, Stephen, who has Alzheimer's disease. How do you handle a situation when a person with this disease hallucinates? He thinks that I'm his daughter and not his wife when we've been married for 16 years. So she says, any advice you have would be much appreciated. Thank you. Wow, that's tough. Karen, do you have any advice for her?
I do. And you're right, Lakelyn. That is really tough for a couple of different reasons. And, when you're married to someone and you become their caregiver, the role that you have changes, and you stop being each other's equal, and you stop being able to have the intimate conversations and basically the intimacy of a relationship, not just physical, but emotional as well. So this is very emotional when a husband or a wife starts hallucinating and no longer knows who you are, or possibly thinks you're somebody else, maybe a sister or a brother, or in this case, his daughter. And so that can be emotionally hard, especially when you're there taking care of them all the time and doing so much for them. You just want that same appreciation that you normally would have in the relationship. So my heart goes out to you, just because I know it can be a little heartbreaking. Now, as far as the medical side of this, when somebody's hallucinating, it's actually very, very common with Alzheimer's disease and other dementias for the patient to hallucinate. There's actually not a lot they can do. There are some medications out there that can try to help, especially if when they're hallucinating, they get agitated and aggressive acting. But otherwise, there are some that can help, but there's not anything that can stop them from hallucinating. And so I wish I had a better answer for you as far as what to do. Now, what you can do is, there's a couple of options. When he starts to think that you're his daughter, if you have some photos maybe from your wedding day or through, your 16 years of marriage, you could put those out around the house, and you can, show them to him and try to remind him. Sometimes this can help trigger, depending on how far along he is with the disease, because what happens is he might remember when you show him, and then literally within a minute or so, he might revert back again. So just depending on where he is with the disease, this is an option that you can try. If it's something where he forgets right away that you just reminded him that you're his wife and not his daughter, that's probably not going to work then. And it might work now, and a month from now, it may not, as the disease progresses. So, and one day it might, and the next it might not. So, it's up to you to try that. You can also try to just play along with it. Some people who are caregivers do that, and they, they're just able to handle that emotional side of it and just play along and say, yes, I am your daughter. And it just makes life a little easier for them instead of trying to fight it or correct him, especially if he gets agitated, if you correct him. Again, a lot of these answers, you'll just have to pick and choose what's right for your particular situation and with your husband. And it could possibly change day by day. You can also try to play music from your years together. A lot of times music therapy can be very helpful, especially with hallucinations. It brings them sort of back into who they were and allows them to remember things from the past. And, I would definitely talk to his doctor and let the doctor know that he's hallucinating, what he's doing, and see what they recommend, because it is a medical condition. It's part of the brain that's being affected by the plaques and tangles that are developing in his brain. So just try to still love him and have patience with him, because I know it's very, very difficult. And again, my heart does go out to you, and thank you so much for your question. And if there's anything else that we can do, please don't hesitate to let us know.
Thank you, Karen. You brought up a lot of great points there. And you made up a good point to make sure that she's communicating to the physician that those hallucinations are happening. And then you also made a good point of, she's not alone. These hallucinations are somewhat common when it comes to Alzheimer's disease, and many people are kind of in her same boat. So thanks for that great answer, Karen. And for those of you on the line, if you have a question, please type them in the questions box, and we will see them on our end. We do have a question. They wanted to remain anonymous, but this is an emotion I think that maybe more people feel than they care to admit. But she says, I wonder how other caregivers have handled the full realization that you have become a full-time caregiver, not feeling like the wife of 50 years that you are. This feeling may go away, but today has been hard. I'm not feeling well, and I have no one that cares for me. What a lonely feeling. My husband has been sick for 9 years. I guess I'm lucky it's taken so long for it to set in. So Karen, my heart goes out to this woman, and she is feeling almost, neglected. No, she's providing so much care, and no one's caring for her. And I'm sure this is a common feeling, again, that people aren't always willing to express or admit, because they want to be that strong, caregiver, that figure in their loved one's life. So any advice for this anonymous individual?
Well, first of all, I am with you. My heart was when I heard this question, my heart just broke for her, because it brought back, just so many memories of being a caregiver for Jim, and how you just sit and watch somebody that you love and you've lived your life with and you've shared so much with, that as they're changing and they're slipping away from you. It's really, really hard on so many levels, personal levels. Just like the previous question, it's so emotional and very, very difficult to live through. On one hand, it makes sense and you can rationalize all of it, but on the other hand, living day to day as a caregiver is really tough. It's tiring. You don't really get any breaks. I mean, just to go to the bathroom by yourself sometimes doesn't happen, let alone getting a shower or just being able to run to the store for something. I mean, it's really a hard job being a full-time caregiver like that. So I commend you for that. And it sounds like you guys have been together a really long time, 50 years. So obviously you've worked through ups and downs and really worked hard to stay together as a married couple. And now you're probably like, wow, what am I going to do? And so for me, looking back, there's some things that I could have handled differently that I wish I would have. And it was so lonely with Jim sitting next to me, but not being able to carry on a conversation, or not remembering something that we did, or, that we talked about. And so one of the things that helped me a lot was writing. So I highly recommend that you start journaling, or, you can start your own blog. You can write letters to friends and just reach out to them, because I know as a caregiver, it's very lonely when you're losing the person that you love, even though they're still living with you. But a lot of times your friends disappear and you're not able to go out and socialize anymore. So I really recommend connecting back as best you can with, if you're a member of a church, maybe, with your church, with your neighbors, maybe people that you used to work with, any of your friends, even if it's been a while, just reach back out to them and let them know you're thinking of them, that you miss them, and you would like to get together if possible, or maybe just talk on the phone. Having some kind of connection with somebody else won't take the place of your husband, but it will at least give you that outlet and allow you to have a conversation and talk about what's going on. Also, if you can reach out to your local Alzheimer's Association, they have support groups all over the country. I'm not sure where you're located, but hopefully if you are able to reach out to them, you can get in touch with them and find out if they have a support group in your area and when they meet. And sometimes churches will also have support groups in your area, so I highly recommend seeking them out too. And a lot of times they will have care provided during the support group time. So you could take your husband, have somebody watch him and take care of him while you are in the support group. And you can get to talk to other caregivers who are feeling the same way, because one of the things that makes this even worse than it already is the fact that you just feel like nobody else understands, that you're the only one going through it, because you're stuck in this rut of you get up, you help your husband with his daily routine, and you have very little time left for yourself. And it seems like everybody else in the world is getting to do whatever they want and go out to dinners and travel and go to movies and go for walks, or, maybe rounds of golf, or, whatever it is that you guys used to do. It seems like they're still continuing on with your life while you're stuck at home taking care of your husband. And I know you wouldn't change that for the world. It sounds like you're, a great caregiver and so happy to be there for your husband. But at the same time, it's really important for you to take care of yourself. And having this despair and this loneliness can really weigh heavy on you and your psyche and your health. So I really urge you to get back in contact with your friends. Try to find a support group if you can. Write in a journal. If you have children, see if maybe they can come around more. If they're not, that is the only thing I can think of, because to be honest with you, there's not a magic answer. Your husband's not all of a sudden going to revert back to who he is. I wish I could say that he is. So it's going to continue to be lonely and difficult, but what you have to do is figure out the best way to handle it so that you can take care of yourself. It's going to be heartbreaking and hard, and I wish I could be right there with you to give you a big hug. So I highly recommend just trying to do what you can to get rid of the loneliness that you feel. And that's going to be a tough act to do. So thank you so much for writing in about this, because I just don't think people talk about the emotional side of being a caregiver enough. And with this question, you definitely did. So thank you so much, and best of luck to you and to your husband.
Thank you for that answer, Karen. You brought up a lot of great suggestions, and I really like your suggestion of the support group or reaching out to somebody, even if it's just talking on the telephone. There's a lot of online support groups now too, or Facebook pages. Remember, for Alzheimer's, Facebook page sometimes can act as a little bit of a support group too, just connecting caregivers that are having some struggles. They can comment back and forth. So that's a really good suggestion that you made for that particular individual. We do have a question. We've talked about, those personality changes. And we had Maria write in. She says that her husband is only 68 years old. In the past few months, it's been getting harder and harder for him to take a shower. So he used to be somebody who took a shower maybe even twice a day, very clean, cleanly gentleman. Now it's been about 2 weeks, and she cannot get him in the shower. She's tried everything. And she says, I'll take any suggestions. I'm so tired of asking him to take a shower. It's very frustrating. It's depressing to me that this disease is turning my husband into a different man. And I think we've heard over the years from these live chats that we We find that a lot of people are feeling like their loved one's personality is changing, their behaviors are changing. So, any suggestions or advice for her on that, Karen? That's Maria asking.
Yes. Thank you, Maria, for, another great question. I love this. I love the fact that we're getting down to the nitty gritty of what it's really, really like to be a caregiver, because I do feel like there's a lot of fluff out there and a lot of great information. But when you're actually down in the trenches taking care of someone, it's definitely really hard day to day. So this is a great question, Maria. First of all, we have actually discussed in the past ways to get them to take a shower and made some suggestions. But I'll go back over with them a little bit. But then I want to touch on the depressing side of watching him turn into a different man. So as far as the shower, you can mirror for him what he should be doing once you can get him in there. If you can't get him in the shower at all, there are options to clean him, a sponge bath. There's some specific cleaning products out there that you don't have to rinse off. They use a lot in nursing homes and rehabilitation facilities that will at least get him cleaned. And, that will help a little bit. There's dry shampoo out there now that you can use as well. Sometimes you have to maybe you can get him to take a bath versus a shower. Maybe if you play some calming music, or there is also some special like videos that you can watch that will show you, like you could grab his hand as he's holding, say, the sponge or the washcloth, and lay your hand on top of his, and then just sort of guide him so he still feels like he's the one washing himself and cleaning himself like that. So there are some options as far as just trying to get him clean and keep his hygiene up. I know that can be an issue with a lot of Alzheimer's patients. So now the other side, it's so depressing watching your husband turn into a different man. This man that used to take a lot of pride, sometimes 2 showers a day, and now, he might go 2 weeks without it. I mean, that's not the man that you've been married to for all of these years. And so it's very hard because on 2 different levels. One, again, it's not the guy you married, and you may not like this guy a whole lot because you want somebody that's going to be clean. Let's face it, that's the way it is. But on the other side, every time he does this, it reminds you that he's not the same guy, and it reminds you that he has the disease, and it reminds you that he is declining and progressing with the disease. So it's like a slap in the face every time this subject of a shower comes up, that he's not the same guy, and he's got this disease that is altering who he is. So that emotionally is very difficult to handle sometimes. So I understand that, because for me with Jim, it was frustrating trying to get him to do certain things. But on the other hand, I was just so sad and depressed and worried about what was coming next. So as far as suggestions, looking back, one of the things I wish I could have done is just stopped, not worried so much about all of this stuff he couldn't do anymore, and just sat quietly with him while he was still with me. And I did have people recommend that to me at the time, and I read it in some books about the disease. But honestly, I was so wrapped up in trying to figure out what was coming next and taking care of the kids and taking care of him. I just couldn't do it. I was told to do it, but I couldn't do it. And so I know giving you the same advice may fall upon deaf ears like it did me, but I would be remiss without suggesting this. Get some dry shampoo, put it in his hair, give him a sponge bath if you can, and then if he will sit with you and watch a TV show, or if he'll get up and dance with you with one of your past favorite songs, or if he's still able to go for a walk outside. I don't know if you're in part of the country that's having this wonderful spring weather. Get out and do it while you can. And that will help a little bit with the depression, because you will be spending time with him, and it will help you later as he continues to decline, because you will have created these memories and you will know that you were able to cherish these times with him. So just like I told the anonymous wife with the previous answer, I do recommend taking care of you. If you are depressed, please seek help. Find a good counselor. See if there is a support group in your area. Reach out to the Alzheimer's Association. Reach out to friends. Make yourself a doctor's appointment and go talk to your doctor about your options. It's really important to take care of yourself, because if you're not healthy, you're not going to be able to take care of your husband. So I highly recommend, maybe if you can get out and get some exercise and either walk, or if you have a gym or a YMCA where you could maybe do water aerobics or get on a treadmill and get you some exercise if that's possible. I know sometimes if you don't have somebody to watch your husband, you may not be able to leave him. So if you have somebody that will come watch him while you go and get some exercise. Exercise is a natural healer for depression. It's one of the best things that you can do to help yourself, even though I know you won't feel like it. That will be one of the last things that you'll feel like doing, but it will be one of the best things that you could do for yourself if you're able to. And again, writing down your feelings, a lot of times putting it on paper and then closing that book, it just is a nice way to release all of the feelings, the frustration, the worry, the anger, the despair. All of those things that you're feeling right now are very natural and very understandable, but it doesn't make it easier dealing with it day to day. So I highly recommend trying to figure out those things that will help release that depression for you a little bit and focus on getting yourself healthy. So Maria, my hat's off to you, girlfriend. I know it's hard with him not taking the shower and turning into somebody else, but if you can hang in there and take care of yourself, you'll be doing great. Thank you.
Thank you, Karen. Those were some good suggestions. And when it comes to the topic of bathing, I know we've talked about this in our past live chats, but sometimes having somebody else, maybe a non-family member, try to approach the bathing issue sometimes is successful. For people with the disease, they're losing their independence, they're needing more assistance, and sometimes they're a little hesitant when it comes to their own family members because they're ashamed and embarrassed. They're uncomfortable because, you are the wife or you are the daughter and you're trying to assist with bathing, and it just might make the individual with dementia a little bit uncomfortable. So if they're able to bring in professional help, that's always a nice option. And for those that are worried about the financial side of bringing in outside help, there is a grant program on our Help for Alzheimer's Families.com website. It's called Hilarity for Charity, and you can apply for that grant, or if you know somebody who would benefit from that respite to be able to get out and go exercise and take care of themselves as a caregiver, then encourage them to apply for that grant, because it's a really great opportunity for that caregiver to recharge and take care of themselves. So I know that was kind of a side note, but when it comes to that bathing issue, I think as you and I know, Karen, over the last year or so, we get the bathing question a lot because it is such a struggle.
We do. It is very common problem, and I loved your suggestions. That was great. Thank you for being there to help me answer these great questions. I appreciate it. You're so good, Lakelyn.
Well, I have all sorts of resources in my mind, so I'm always happy to be able to shout them out. All right, we have another question, but if you're listening, if you're online and want to write in a question, please, again, feel free to type it in that box right there on your screen, and we will make sure to get to your question. So we have a question from June, and again, I just want to preface this, it might be a little bit of a sensitive topic, but she is wondering how to go from a caregiver into sexual intimacy with her husband. And again, this is kind of one of those taboo topics that nobody wants to talk about. There's not a whole lot of literature out there for caregivers who are dealing with this. She says, sometimes my husband wants to engage in sexual intimacy and I don't want to, or sometimes he wants to and I'm not feeling it, or, he might want to and then forget that he wanted to. And then she said he even one time woke me up in the middle of the night to admit that he'd been watching, some more sexual movies of that sort, and he felt guilty, and she's conflicted. She doesn't want him to feel embarrassed to talk about this. She doesn't want him to feel like he's being, a bad person or feel like he's, being treated like a child in this situation. She said, I can't find any books or any advice on this issue. Can you please help me? So, Karen, this is kind of a tough and sensitive one, but do you have any advice for June when it comes to this topic?
Oh my gosh, June, thank you for sending this question in. You're right. There's not a lot of information out there. I never found any information about it either, and you're not the first person that has written in with this type of question. So, let's face it, we're adults here. We're listening on this conversation as adults. Sexual intimacy is a huge part of a marriage. It's part of every marriage that I know. And so as the, person with the disease declines, this does become an issue, and it probably should be discussed more than it is. So definitely don't feel bad about, having this question, June, and thank you for sending it in. Without obviously being able to talk to you face to face and have a back and forth conversation about this, it is a little difficult to really answer you specifically. So I'm going to have to be a little general on this one, and I'm going to hope that I do still touch base with you as best I can. So one of the things that I would like to say is, people change, and people with the disease have different ways that it manifests with them. And sometimes they become much, much more sexually active. I have had letters written in from people whose spouse all of a sudden starts having affairs. And, it's because of the disease, but it doesn't make it any easier to deal with. And then sometimes, they go the opposite way, where they no longer have any kind of sexual desire whatsoever. So there's a lot of ways it can go either way. So it seems to me like with your husband in particular, June, that, he's going the route where he's a lot more interested. He's watching these movies and he's coming to you wanting to basically react to the movie, or maybe he wants you to come and watch it with him, or, it's gotten him in the mood and he's wanting to come to you and release, these feelings that he's having. So I definitely can understand how when this happens, you, first of all, even in a normal marriage, chances of him coming and waking you up and you wanting to do anything when you've been sleeping, unless you are, newly married and 22 years old or something, you're probably, way past that stage of being woken up in the middle of the night and being ready to go. So let's face it, even in the best of marriages, you probably wouldn't be wanting to do anything. So, so that being said, it's really difficult because, when you talk about them not being able to perform the same, to me, it got to the point where I felt sort of gross with Jim, just simply because it was almost like maybe I would be taking advantage of him because of his mental capacity I knew was declining, and his physical ability. And even if he had instigated it, so it definitely wouldn't have been me taking advantage of him, it just didn't feel right. The intimacy and the connection that we had was gone. Our normal routines were gone, and I just couldn't be comfortable with him in that role anymore. So I get what you're saying, and I think it's very common. But at the same time, you don't want him to feel bad, or you don't want him to feel rejected, and you still want to be able to have that kind of connection with him. So again, depending on your particular situation, are there some other things maybe that you guys can do together that would facilitate a closeness that he's obviously looking for? He knows that he's changing, and this might be his way of reaching out to you and trying to hold on to the intimate side of your relationship. So I would try to hold on to that as long as you can, and see if maybe there's some other things that you guys can do that will satisfy both of you. And, talk to him. I know you said you felt bad. He feels like he's being bad. Let him know that it's okay. Try to support him with this so that he doesn't feel like he's doing something wrong. Even if maybe you feel like he is, I don't know. It depends on your own personal preference, but, let him know that it's okay, that you still love him, because after all, that's what everybody wants to know. They want to know that they're loved, that they're respected, that the person that they're trying to open themselves up to wants them and desires them too. So just like before in your marriage, I'm sure there was times that he was wanting to and you weren't, and you were able to talk to him about it, or maybe you had a headache that day, or, whatever. So there might be options of just trying to hold him off on this, but at the same time feeling connected. Maybe you guys can lay together in bed next to each other, just snuggling and holding each other and having that physical closeness without actually having intimate relations. So I encourage you, for as long as possible, to still try to keep that connection, because I think in the long run it will make you feel better, and in the short run it will definitely make him feel better. So I hope this answer has helped you, June. It's definitely something to keep working on, and as he progresses, things are going to change. His abilities are going to change. Your abilities are going to change. And so keep that in mind. One time, it might be the last, and then you won't have to worry about it. So, but definitely let him know how much you love him and that you desire him too. And I think that'll make a big difference. So thank you so much for sending that great question in.
Karen, thank you for a great answer. I think that you gave June some really good advice there on this really, touchy, difficult subject. But I like that you brought up, in marriages, they, in that sexual intimacy, they kind of go in ups and downs and waves and ebbs and flows. So it's important to remember that is likely to happen if one of the individuals has Alzheimer's or another type of dementia. So thank you for that. And I'm going to segue a little bit. We have a question more so about the family dynamics and those types of relationships and how Alzheimer's and dementia affects that. Melissa wrote in. She says, "What can I do when I have family who won't help and ends up causing more problems? I have a sister who completely refuses to help. She won't communicate what she's willing to do, and when I try to discuss the situation, she shuts it down as if when she's in my presence and will walk away, or she hangs up, or she doesn't answer her calls or text back. And both of our parents have dementia, and she lives right across the road where I live 15 minutes away from my parents." So, wow, it sounds like Melissa has a lot going on, and this family dynamic with her sister is not helping matters. Do you have any advice for her, Karen, on maybe how she can engage her sister, or how her and her sister can kind of overcome these communication issues?
Yes, I definitely can feel that pain. So, Melissa, I am sorry about this, because sometimes the lack of support from other family members can be almost as hard and hurtful as watching, your parents decline. And it can get so frustrating. It can overtake you and your personality so that you build up this huge resentment and become more hateful and spiteful. I mean, there is a lot of stuff going on here, Melissa, outside of you just being a caregiver for your parents. So I definitely want to take some time to talk about this, because this is actually extremely common in situations, especially dealing with parents. Usually with the spouse, of course, the other spouse that's not sick is supposed to be the caregiver, and that's understandable. And sometimes there's issues with the kids not coming around or siblings and things like that. But for this, it's always, very difficult when it's the parents. I think you said it was both parents that have dementia. And so that's a lot of work, taking care of two people versus one. So Melissa, I don't know exactly what kind of conversations you've tried to have with your sister. Obviously, the first step I would always recommend is some kind of communication. So I know you said she won't communicate with you. She either hangs up on you or she shuts down. You might want to try writing her a letter. You might want to try setting up a meeting. I don't know what kind of, if she's married, if you have a relationship with her spouse, if you can have some kind of intervention. Try to figure out why she's doing this. Has she always had this personality where she sort of, clocks out and looks the other way and doesn't face things head on? Or is this something relatively new and isn't her normal personality? If that's the case, she may be doing this because she's in denial of the progression that your parents have had. And you said she lives right across the road. She must have been pretty close to your parents to live that close to them. Obviously, being right across the street, she had some kind of relationship with them. It must have been a good one. And so she might be doing this as basically a protection for herself, because it is so hard for people to watch someone they love and they don't want to lose as they decline. So I'm not saying that that's right, and I'm not making excuses for her, but I have seen this type of behavior so many times in people. And unfortunately, what happens in the end is they end up regretting not being around to help more and to be there for their parents, especially. So that might be something that you can point out to her, that one day she's going to regret it, but in a nice way. Try to be nice. I know it's hard because you're frustrated and resentful and all of those things. If you can't communicate with her at all, there's really not going to be a lot you can do. There's no legal recourse here. You can't make her, in life and in this world, there's things that people should do. There's things they're expected to do. And there's things that they don't want to do, but they do them anyway. And in this situation, the right thing for her to do is to help care for your parents, but it doesn't mean she's going to do it. Not everybody does the right thing. So you really don't have a lot of options as far as making her do it. The only thing you can do is try to help her see that it is the right thing to do, and that's what's best for your parents. I don't know how far along your parents are. If you have a kind of relationship with them where they're still cognitively aware enough and their abilities are still there, you can have them talk to her. That has happened in the past with people that are a little bit earlier in the stages, and they're able to let their children know that they need help and that, they would like them to come specific days. There's always the option of you taking some time off, where if your parents are far enough along, they have to have constant care. Tell her you're going on vacation and she has to go over there and take care of them. She doesn't have a choice. Otherwise, for their health and safety reasons, she's got to go and do it. I have seen people do that as well. And then she will see how much work it is for you and what you're going through. You can't do it for like one day. It's going to have to be a length of time that you have her go and do this. So those are some options that I am thinking of right off the top of my head, Melissa. I'm wondering if there's some more advice. I bet there's people out there listening that have dealt with the same thing. Because like I said, it is extremely, extremely common to have issues with family members not helping or stepping up to the plate or disappearing. So if anybody out there has dealt with this and they have some suggestions, please really go ahead and type in what your recommendations are so we can share that with Melissa. Because let's face it, when we're all in this together, the more minds working on answers and solutions, the better off we all are. So thank you again, Melissa, for sharing your story with us.
You bring up a great point, Karen. We all have to share our stories and our tips and advice, and because every situation is different, and you'll try one thing and it'll work in one situation and maybe not so much in another. So if we can all share our advice and our experiences, then it'll help the greater good in this community of family caregivers. And I know from my experience, what I've found to be somewhat successful when there are some sibling conflicts like this is to figure out, what your sister's strengths are. If she's really a good cook, or if she is super organized, or if she's in the healthcare profession, maybe assign or ask her to do specific tasks that complement her strengths or what she's good at or what she likes to do. So, if she is a good cook, maybe asking her to do specific things, like maybe cook mom or dad a meal once a week or a couple times a week. Or if she's in the financial realm, maybe you assign her the bills and those types of things. Or, if she's in the healthcare field, maybe assign her those doctor's visits to take the parents along to and take notes. Those types of things, especially if there's a male in the family, a brother or son. A lot of times with men, if you ask them directly to help with something, instead of just saying, I need your help, rather say, could you pick up the groceries for me and take them to mom's house every Friday, then they're more likely to do it because they have a specific action. So that might be just one more tip for Melissa. And we actually had a different Melissa write in the question. So she, kind of along the same lines, she says, are there any recommendations for parents who are not really accepting an Alzheimer's diagnosis 2 years later nearly? And then it's as though everyone, the entire family who is accepting this, has to walk on eggshells all the time when they're around my mother now. So thank you so much, Melissa, for writing in this question. And Karen, do you have any recommendations on what you can do to maybe help your loved one accept an Alzheimer's diagnosis?
Well, unfortunately, boy, a lot of these things are just very common. It seems like there's a generation of people out there whose typical reaction to health issues is denial, whether it's dementia or cancer or heart problems or obesity. For some reason, sometimes people get in their mind, if they don't talk about it or they don't acknowledge it or they don't go to the doctor or, whatever, fill in the blank, then it's not true, it doesn't exist, it's not really happening. And unfortunately, that doesn't do anybody any good. So there's actually not a lot you can do to get them to accept a diagnosis. It's their personality, it's what they're doing to cope with it. It doesn't make it easier for you or your siblings or other family members at all. Actually, it makes it a little bit more difficult. If they could see it from your point of view, I'm sure they would not want to make it more difficult. So other than sitting them down and explaining this to them, how their denial causes XYZ issues for you and make it more difficult. Fill that XYZ in with different examples of how you need them to acknowledge what's going on, and do some introspective thinking about it. Why do you need them to acknowledge? Why do they need to accept an Alzheimer's diagnosis? What is it that you're expecting or hoping for that will change once they admit they have this diagnosis? So instead of trying to get them to change, because if they have this disease, they're not going to change. Their brain is no longer working the way it used to. They're not fully capable of this. So my question to you is, Melissa, what do you hope to gain if all of a sudden your parents acknowledge and admit that they have Alzheimer's? It's certainly not going to change the disease and how it's affecting them. I think the only thing it will do probably is make it a little bit easier for you, and you guys can talk about it, because I don't, you mentioned walking on eggshells around your mom. So my question to you is, why are you walking on eggshells? Because you're not able to discuss the disease with her. You're not able to point out to her things she's forgetting or not doing. What is it that would change? So that would be my first question to you, to answer yourself and do a little bit of self reflection. Then after you come up with that answer, see whatever your answer is, see how you can fit that into your family dynamic. Is it important because you want to talk with her about end of life decisions? Is it important because you want to take her to the doctor and get her on specific medication? Is it because you want to have another caregiver come in and help with them? At that point, once you figure these things out, then you can have those discussions with her, and maybe if she won't acknowledge that she has Alzheimer's, you can base it on something else. Does she have some other kind of physical ailment at all? Maybe you're worried about her falling, so you can talk to her about that, but you don't have to bring up Alzheimer's, because Alzheimer's is a really scary word for a lot of people to hear, and you really just don't want to have a reaction from her that could lead to other complications. So my question to you, Melissa, is let's figure out why it's so important to get that, and then go from there. I hope that makes sense. What are your thoughts on that, Lakelyn?
I think that you made a lot of good points there, Karen, and that is a really tough tough thing to cope with as a family member, someone with Alzheimer's or dementia, not knowing, the real specifics of the family and all the family dynamics, as you mentioned. It can make responding to this question a little more difficult. But if the person with Alzheimer's is not willing to accept the diagnosis, it may come out of a place of fear, because unfortunately in our society, the word Alzheimer's still comes with a stigma. They think that people will treat them differently if they admit that they have Alzheimer's, or if they have to tell people that they have Alzheimer's. They may be afraid of losing their independence because they know that Alzheimer's is a brain disease, and it's going to slowly rob them of their physical abilities and their mental abilities, and they're going to have to lean on you as a family caregiver for more assistance. So I liked Karen's suggestion of, really kind of reflecting on, what about the situation is the most challenging? I mean, or why bringing up the diagnosis is important? Is it because you want to take them to a special geriatrician who specializes in Alzheimer's and dementia? And they will only accept patients that are aware of their diagnosis, something of that nature, or is it that there are those financial decisions that need to be made? I like that you pointed that out, because a lot of times for people with Alzheimer's or dementia, that can be a really tough decision or conversation to have, because unfortunately there is no cure for this disease, and that is unfortunately what will happen, to the individual. They're going to pass away from complications of Alzheimer's at some point. So I think that you did a really nice job of addressing that question. And Melissa, our hearts go out to you, because it's not easy. It's not easy to care for a parent with Alzheimer's, and to accept the diagnosis yourself as a family caregiver. So thank you for writing in that question. We really appreciate it, and we wish you the best of luck, and the rest of your family, and to your mom. Um, and thank you for all that you do as a family caregiver, because we recognize that it is not always easy. But we had one more question, Karen. I know we have about 5 minutes left, so I wanted to squeeze Lisa's question in here really quickly. Um, she says that she has two parents with Alzheimer's disease. So, my heart immediately breaks for her, because one parent, I can't even imagine having one parent with Alzheimer's, let alone two. And she says she's still working a full-time job. She's a wife. She's trying to get one child out of high school and another out of college. What does she do? And I know that this is really a broad question to ask. She seems very desperate for advice. Karen, any thoughts or any suggestions for her on, how to reach out for help, or just some good first steps for Lisa as she tries to navigate this very complicated caregiving situation?
Yes. Thank you. And thank you, Lisa, for writing in. First of all, I'm really sorry about your parents having both of them with Alzheimer's. That's, as Lakelyn said, that's a lot. And I do feel for you, as I was a caregiver myself with, young kids at home. And at one time, I also worked a full-time job. And, I ended up having to quit my job, which, cost me my career that I had started at that time, so that I had going on. So one of the things I do want to say to you is not knowing how far along your parents are, if they need help, currently, all the time or not, eventually they will. So it's really important to have a plan in place. So it sounds like you're trying to do that, because that's why you sent in this question. So, so definitely, determine, are you going to keep your job? Are you going to hire somebody to come in and stay with them? Are you going to look to place them in a home? What's going to be your options when it's time for them to have full care? And so that will determine, a lot of how I answer this question, because if you're going to quit your job and stay with them, that's a lot. You still need to have backup plans for when you have other things to do. It sounds like you have somebody in high school and in college. So you need time to spend with your kids, to go to college graduation, high school graduations, and spend time with them. This is still your time with your kids. So you can't be 100% with your parents. So definitely figure out what your plan of attack is for that, and talk to your kids about it, about how difficult, and your husband, how difficult this is for you emotionally. See if they can help you out. One of the best lessons my kids learned was empathy and how to care for their dad. This could be a life-changing and life-learning lesson for them, to get them involved as well. Not only in the care, but in the decision-making process. One of the things that I took a lot of pride in is I didn't hide a lot of stuff from my kids, and I felt like that allowed us to continue having a really, really close relationship. And I feel like that's so special, and they always knew what was going on. So make sure you keep everybody in the loop of where you're at emotionally and the decisions that you're having to make, and see what their thoughts are. Obviously, they know your situation better than we do. And, how flexible is your work? Are they going to work with you when you're having to take your parents to doctor's appointments, and when you're having to drop everything because one of them has fallen and you need to take them to the hospital, or you need to go to rehab to visit with them. So, try to have as much of this in place, because there's certain things that are going to happen and you just don't know when. So it's almost like just waiting for that ball to drop, waiting for what's around the corner. And so you're not going to be able to predict everything. You're not going to be able to plan for everything, but making sure you keep communication open and that you talk to everybody and everybody knows, what you're thinking and feeling, I think will be a huge step in the right direction. So best of luck to you, Lisa. Thank you so much for sending that in. And again, if you have any other questions specifically, please send them in to us. Maybe we can answer them next month, or we can put them on our website for you.
Thank you, Karen. And I did just want to give Lisa a few resources. Definitely reach out to her local Alzheimer's Association to find a support group, to get connected with resources in her community. I like that you mentioned, Karen, creating a plan. And actually on our caregiverstress.com website, you see that on the screen now, there's an aging action plan. If you actually, you can find that at 4070talk.com. We encourage, all families, when the adult children are about age 40, parents are about 70, to have conversations about the care that they want to be receiving. And if, Lisa, your parents are still able to engage in that decision process of what they want down the road, that is really important to have those conversations early. And then that respite grant, down the road, if you do take over care for your parents and need a little extra assistance, you can always apply for that respite care grant for free in-home care at helpforalzheimersfamilies.com. So, Karen, thank you so much for coming on to the live chat today and for sharing your personal experiences with relationships and Alzheimer's and dementia, and for all of your great advice. We really enjoyed having you. So thank you so much.
Thank you, Lakelyn. I enjoyed it, and I certainly hope that we have helped as many people as we can. So we're all in this together, people. So continue sending us those questions. It's really great to hear from so many wonderful people out there.
Yes, I agree. Please send in those questions. And our next live chat will be in March. We don't have the date 100% decided on. It'll probably be around mid-March. And we're looking to explore the emotions of caregiving a little bit further in that next live chat. So be watching our Remember for Alzheimer's Facebook page to get the registration information for next month's live chat. And I know we'll have Karen back later in the year, so we'll look forward to that. So thank you, everyone, for joining us. Have a great rest of your evening. Take care. Bye.
Bye.